Hello, everyone. Thank you for joining us. Today, we're going to talk about a part of your body that you might not think about often, your pelvic floor. This topic is incredibly important for both men and women, yet it's often overlooked. In this session, we'll explore exactly what your pelvic floor is, why its health is so crucial, and most importantly, what you can do to strengthen it and improve your overall well-being. First, let's define what the pelvic floor is. Think of it as a strong, supportive hammock or a trampoline at the base of your pelvis. This hammock is made up of muscles and tissues that provide a foundation for your internal organs, specifically your bladder, bowel, and, for women, your uterus. Its job is to help you control when you urinate or have a bowel movement, support your spine, and contribute to sexual health. While we often associate pelvic floor issues with women, it's just as important for men, especially as they get older or after certain surgeries. When these muscles weaken, the hammock can't do its job properly, leading to a cascade of problems. The most common and often embarrassing symptom is urinary or bowel leakage. For example, if you sneeze or laugh and a little bit of urine escapes, that's a key sign of a weak pelvic floor. Another issue is pelvic organ prolapse, which can make you feel a heaviness or even notice a bulge. While more common in women, men can also experience a form of prolapse. Pelvic floor issues can also affect your sexual health and can even contribute to chronic lower back pain that may not respond to other treatments. So, what causes the pelvic floor to weaken? While the reasons vary, they often stem from a combination of factors. Pregnancy and childbirth are major causes due to the strain of carrying a baby and delivery. As we age, muscles naturally lose tone. For women, the hormonal changes of menopause also play a role. Chronic straining from a persistent cough or chronic constipation is a big contributor for both men and women. Carrying excess body weight and certain surgeries, especially prostate surgery for men, can also weaken these muscles. The good news is that you can strengthen these muscles, and the most well-known way to do that is through Kegel exercises. The first and most important step is identifying the right muscles. A simple way to check is to try to stop your urine midstream once that's the feeling you're looking for. But don't make this a habit. Once you've found the muscles, the exercise is simple: squeeze and lift the muscles, hold for a few seconds, and then fully relax. The relaxation is just as important as the contraction. Aim for 3 sets of 10 to 15 repetitions every day. You can do them anywhere at your desk, in the car, or while brushing your teeth. While Kegels are the foundation, other exercises can also help. The bridge pose and squats, when done correctly, engage your core and pelvic floor together. It's also important to strengthen your entire core, as the pelvic floor is part of what we call the core canister. Exercises like diaphragmatic breathing, or belly breathing, can help coordinate all these muscles. For those who need more help, there are advanced tools like vaginal weights or biofeedback devices that can provide more targeted training with real-time feedback. Beyond targeted exercises, your regular fitness routine can make a big difference. For most people, brisk walking is the Goldilocks zone of exercise. It's low impact, engages your core, and helps strengthen the pelvic floor without putting too much strain on it. High-impact activities like jogging can be a double-edged sword. If your pelvic floor is already strong, it can be a great workout. But if it's weak, the repetitive impact can be harmful. Always listen to your body. A leisurely stroll is good for your health, but it doesn't provide enough of a challenge to truly strengthen the muscles. Your daily habits are just as important as your exercises. A high-fiber diet and plenty of water are critical for preventing chronic constipation, which is a major source of strain on the pelvic floor. When using the toilet, avoid straining. A small footstool can help you sit with your knees elevated, which naturally relaxes the pelvic floor and makes things easier. Also, simply being mindful of your posture and gently engaging your core throughout the day can make a big difference. While these exercises and tips can be very effective, they aren't a complete solution for everyone. It's important to know when to seek professional help. If you're experiencing ongoing symptoms like leaks or pain, or if you feel a bulge, please don't hesitate to consult a professional. A specialized pelvic floor physical therapist can create a personalized plan and help you with biofeedback to ensure you're doing the exercises correctly. For a medical diagnosis, a doctor, urologist, or urogynecologist is the right person to see. To wrap things up, here's a quick checklist you can use to build your daily pelvic health routine. Consistency is key. Remember to do your Kegels, be mindful of your posture and breathing, maintain good hydration and diet, and most importantly, listen to your body. Building a strong pelvic floor is a journey, and with these simple steps, you can build a solid foundation for a healthier and more comfortable life. Thank you.